Everyone, welcome back to the HI Hub. I'm Elizabeth Keith, co-chair of the AHIMA Legislative Committee.
And I'm Pam Holliday, your other co-chair. We're thrilled to share our experiences from the AHIMA Advocacy Summit and discuss some key legislative proposals that could really shape the future of healthcare.
All right, well, we've got a lot to cover today, so we're going to go ahead and just dive in. The AHIMA Advocacy Summit was an incredible experience. It was so inspiring to see so many passionate professionals coming together to advocate for these important issues. What are your thoughts, Pam?
Absolutely. I really enjoyed it. The energy and the commitment from everyone was incredible. It was really just a fantastic opportunity to network with others in the profession that are very passionate about advocacy and learn from experts in the field.
Yeah, absolutely. And I think that it's important for people who haven't been before. It is a great opportunity to network with other health information professionals, but also you get the opportunity to network with AHIMA staff, as well as the congressional staff at the offices in which we had those meetings. So let's talk about some of those key takeaways from day one. Day one kicked off the Policy Institute and was packed with some great informational sessions discussing the future of electronic prior authorization, the importance of health equity and social determinants of health, the healthcare policy in the 119th Congress, the future of AI, and improving patient matching. Attending for the first time, Pam, what was a moment or a session that really stood out for you?
For me, there wasn't one single moment that stood out, but rather just that overall first day really made a difference. I found the information and the prep work on how to meet with the congressional offices very helpful, just to keep that flow of the conversation going, how to get our point across and our message delivered to them. To me, that was probably the single most part that stood out, was how well they helped us prepare to go to those meetings on the Hill.
Oh, absolutely. I definitely agree. I know that my first year felt really intimidating, but like you said, AHIMA really does a great job of hosting the training session. I'm not really for sure what they called it, but just to prepare you for what to expect. And then everyone there is so helpful and willing to help and answer any questions too. After such an informative day, we had day two, and that brought a different kind of an excitement as we engaged with the congressional staff. Let's talk a little bit about how those discussions went. Day two was all about engaging with congressional staff at Capitol Hill and advocating for legislation. We had some really great discussions about the Match It Act of 2025 and Advancing Non-Clinical Artificial Intelligence in Healthcare Act of 2025. So let's talk a little bit about what each one of those are.
Yeah, so the first proposal that we introduced was the Match It Act of 2025, and that aims to improve patient matching within healthcare. It proposes defining a patient match rate and establishing an industry standard for that data set, as well as updating health IT certification requirements and promoting interoperability.
Yeah, for those that aren't super familiar with the Match It Act and improving patient matching, there's not really those standards in place. And with this act, we're asking that those standards be put in place, not only for the healthcare facilities, but also that health IT portion of it, and making sure their certification requirements are in alignment. Also, we had the Advancing Non-Clinical AI in Healthcare Act of 2025, where this act focuses on the integration of non-clinical AI in healthcare, like computer-assisted coding and claims processing. It calls for a report on the current usage of AI, development of educational materials, and an education campaign.
Yeah, so the goal here with the Advancing Non-Clinical Artificial Intelligence in Healthcare Act is to make sure that our workforce is ready. So there are some key components of that proposed legislation, and part of that is creating materials to help ensure that our workforce is ready, as well as preparing the future workforce for that as well.
Absolutely. And during our discussions with the congressional staff, we covered a lot of points for each of these. Do you want to talk about your experience meeting with congressional staff and the response that we received from them?
Yeah, the staff were super receptive to the information that we had to share. They did ask some very insightful questions, and it was really clear that they were genuinely interested in the proposals, and were excited to take those back to their bosses and share that information. So they appreciated the detailed information that we were able to provide them, and did express support for further exploration of both items that we brought forward, which was really encouraging to us.
Absolutely. I think that they really appreciate meeting with constituents from their area and hearing how these pieces of legislation can have an impact at home. Now let's take a moment to share some personal insights from the summit. There were definitely some memorable moments. For me, the most memorable moment was receiving the Grassroots Advocacy Award for the Large State Component Association. It was really a proud moment for Indiana.
Oh, I couldn't agree more. It's a true testament to how hard our organization has worked and the dedication of our members. And for those that might not know, the AHIMA Grassroots Advocacy Award recognizes the top state or district that has shown significant engagement in grassroots advocacy and policy initiatives identified within the AHIMA advocacy agenda.
Yeah, absolutely. States are able to gain points throughout the year based on the actions of their members. Those points can be earned through engagement in AHIMA federal grassroots advocacy initiatives and campaigns, and other actions that can be found on AHIMA's advocacy page. These can include serving as a speaker or author on federal policy related topics for AHIMA or your component association. You also get points for congressional office visits or attending AHIMA briefing or webinars, as well as their advocacy modules. If you've not had the opportunity to go out there to the advocacy page, there's a lot of great information. And even if you're just getting started in your advocacy journey, there's a lot of education on what steps you can take and how you can become more involved too.
Yeah, we can talk more about how these legislative proposals and our involvement could impact the future of healthcare. I think that's our key takeaway and our overall goal.
Absolutely. These legislative proposals have the potential to significantly improve healthcare by enhancing patient safety, reducing costs, and ensuring better data management.
Yeah, they also pave the way for more efficient and effective use of technology in healthcare. And that's crucial for future advancements. It really is exciting to think about all the possibilities that lay ahead.
Yeah, so what's next for us? Let's talk about those next steps for the AHIMA Legislative Committee following summit. So following the
Yeah,
summit, yeah, go ahead.
no, you're fine. Go ahead.
So we really want to continue to advocate for these legislative proposals, engaging with our members and encouraging more involvement at the state level.
Yeah, so in addition to everything that you mentioned there, we also plan to follow up with the offices that we met with on Hill Day, and soon we will be planning how we can continue the momentum we've got going this year into next year. And I would really encourage anybody, any of our members that are interested in participating in advocacy next year, to reach out. And if you have an interest in sitting on our committee and being more involved, that's perfect. Or if you just want to be involved in different activities and find out how you can advocate for the items that are important to us as we move forward, we can help you do that as well.
Yeah, absolutely. I agree with all of that. I think that moving forward, like you said, we want to continue this momentum and continue our efforts year round, whether that looks like attending town halls, sending emails, making phone calls, meeting with our congressional leaders and their staff locally here in Indiana so that we can build those relationships, so that when they have something that's coming across their desk that's health information related, we're the experts and we're the ones that they're thinking of to go to with their questions.
No, I could not agree more. I feel like, we're very lucky to have been able to have such an involved component association, and I feel like that's just going to continue to grow and it will make a difference.
Absolutely. I think it's important to remember that your voice matters, and AHIMA members are the experts on these topics. We want to thank you for joining us today. We hope you found this podcast informative, and we look forward to talking to you next time. Thanks, Pam, for joining me.
Thank you.